Hello, and welcome to another episode of LSVT Global's podcast, Think Big and Loud, where we share inspiring stories, expert insights, and engaging conversations, all designed to empower and uplift the lives of individuals with Parkinson's disease and other neurological conditions, and those who love and support them. My name is Beth Peterson, and I'll be the host for your show. Today's episode features special guest Dr. Jory Fleisher, a movement disorders neurologist at Rush University Medical Center, Parkinson's disease and movement disorders program. And Dr. Fleischer has a special interest in understanding the needs of individuals and families who are living with advanced Parkinson's disease and related disorders. The focus of our episode today will be Dr. Fleischer's PERSEVERE study, which is testing an educational program for family caregivers of people with Parkinson's disease with cognitive impairment, Parkinson's disease dementia, dementia with Lewy bodies, or Lewy body dementia. And collaborating with Dr. Fleischer at this time is particularly relevant as October marks Lewy Body Dementia Awareness Month. So, Dr. Fleischer, welcome to the show. I'm excited to discuss the PERSEVERE study with you today.
Thank you so much, Beth. Thanks for having me, and thanks to everyone for tuning in and watching and learning.
Well, great. We'll go ahead and get started. And can you start by telling us what inspired you to initiate the PERSEVERE study and what are its primary objectives?
Absolutely. So as a movement disorders neurologist and a researcher really focused on how do we build better systems, because I think all of us caring for loved ones, caring for people with Parkinson's and related disorders recognize that while the healthcare system can do a lot, there's a lot that it doesn't do, right? And we've been trying to figure out how do we keep everyone in the loop of care. And so we began by actually bringing clinical care to our most advanced folks. So doing home visits, starting back in New York and then moving that over to Chicago where I am now. And what we found was we could do a lot in a home visit for our people living with Parkinson's. But when we followed people over time, even if we could stabilize our individuals with Parkinson's, the care partners were still having increased strain, an increased burden. And there's a lot of research showing that caregivers, family caregivers of a person with Parkinson's are quite different than family caregivers of someone with Alzheimer's, for example. That our PD caregivers and our Lewy body dementia caregivers have higher rates of depression and back pain and strain and arthritis and high blood pressure. And this we think is directly related to caring for someone with Parkinson's. And there's not a whole lot out there that's been studied to work on this. And so we really said, what else is out there? What can we pull from any other condition? Like what is low-hanging fruit to help our care partners thrive in this marathon of caring for, someone with Parkinson's in their life?
Well, great. It's very important work for sure. So I'm glad that you're heading it up.
Thank you.
And so what are some of the most surprising findings from the home visits conducted during phase 1 of your research?
Yeah, it's a great question. So initially, when we did our home visits, we were really trying to reach folks with Parkinson's who were more advanced. And for people who are familiar with Parkinson's, you might have heard of, someone is stage 2 or stage 3. We have this staging system called the Hoehn-Yahr scale, and it goes from 1 to 5. And stage 1 really means symptoms are on one side of the body, very mild. Stage 2, symptoms are on both sides, but still mild. Stage 3 is when balance is starting to be affected, but people are still fairly independent. And stage 4 means someone needs to use an assistive device like a walker or a cane to get around. Stage 5 means someone is a wheelchair user or maybe bedbound unless they have help from someone else. But in a lot of Parkinson's studies that nominally in the title say, study of XYZ drug in people with advanced Parkinson's, they often enroll people who are at stage 3. And it really led us to question, if there are all these studies that say that they're about advanced, but they're calling stage 3 out of 5 advanced, like what are we calling people who are at stage 4 and 5? And the answer was we weren't calling them anything because we weren't including them in research. And if people struggle to get to the clinic, if people struggle to connect with their healthcare provider, then they're not going to be represented even in surveys, let alone in, more involved clinical studies. So we found that, number one, people would actually let us into their homes. This crazy idea of, can we just come to you?
Yeah.
That people were willing to let us in. And this was, everywhere from penthouses on Fifth Avenue in New York City to tiny, second story walk-ups with, really tiny apartments, and people really struggling to make it work and choosing between food and medication.
Mm.
And we found that even in this population of folks with Parkinson's, who too often are written off as, there's really nothing that we can do, I would argue that's only because we haven't tried. So we found that even though in every other study of people with Parkinson's, as time goes on and disease kind of goes like this and function declines, usually quality of life sort of parallels right along that slope. But in our study of home visits in New York, and then similarly in Chicago, we actually found that quality of life stayed the same. And some areas of quality of life, things like bodily discomfort, right? Just aches and pains and discomfort. We actually were able to move the needle and improve things. So as much as we think about PD as a progressive disease, there is so much we can do. And I think that was one of the really surprising things, as we compared with a control group who was younger and healthier at the start and throughout the entire time. So kind of apples to oranges. But our apples did better in a lot of ways than our oranges, even though that's not what anyone would have expected. And when we sort of moved home visits and we said we need to do more for care partners, we took this idea of peer mentoring, which means sort of enlisting and training someone who's been on this journey before. So for us, this was a family caregiver who'd cared for a loved one with Parkinson's or a related disorder. And we gave them some in-person training, kind of getting everyone on the same, having the same level of knowledge. Maybe your loved one didn't have hallucinations, but we'll explain that to you so you know what we're talking about. And then matching those trained caregivers with one of our caregivers of someone who was in home visits, so a homebound individual and their care partner. And just saying, hey, here's someone who will get it. Would you just talk with them once a week and see if that's even something that is okay with you, and let us know how it goes? And people said, give us a little bit of information that we can kind of use as a jumping point to talk with each other. So we just threw together, like, here are some of the handouts that I give folks in my own clinic. If someone says, I'm really struggling with constipation, great. Have I got tips for you? Or, how do we work on sleep hygiene? Or, how do we handle hallucinations or agitation? Just some really simple stuff. And we found that it worked really well. People talked with each other. They had lots of questions. They actually did it, even though they all had so much else on their plates. And so that was really surprising. And we think that contributed to the fact that in the control group, caregiver strain got worse over the course of a year, just like we see in almost every other study. But in our really advanced folks, caregiver strain stayed the same. And we think some of that had to do not just with home visits and the care that they were receiving, but really the peer support of someone who's been in their shoes.
Yeah. It makes sense. Yeah. But you're the first to do it, and you can see, yes, that this is the way to go. So that's really wonderful for that support network to be there.
Yeah.
And you've kind of talked about it a little bit, but how does the PERSEVERE study address the unique challenges faced by underserved care partners?
That's a great question. So we have been incredibly fortunate that at every step along the way, from the first home visit study to the second study and introducing peer mentoring and multiple iterations and pilot studies leading up to this PERSEVERE study, we have partnered with care partners. So this intervention is designed by and for them. And actually, as part of our NIH-funded study right now, we have 6 Parkinson's or Lewy body family care partners who've not only walked this walk, but they've been part of the mentoring programs in sort of past versions of it, and have said at every step along the way, you're not talking enough about this. We need to hear about hot and cold dysregulation. I didn't know that was a thing. No one talks about that. We need to talk about visuospatial dysfunction and why my loved one kept bumping into things or dropping things. And, you need to tell us about the emotions that go with and the actual practical logistics of what if I need to look into a nursing facility?
Mhm.
What do I do? What's that checklist look like? And how do I cope with the difficult emotions that I might feel? And so we know that there are so many specifics about caring for a person with Parkinson's or Lewy body. So we took that little teeny handbook with like a couple of, simple things, and with the input from rounds
Yeah.
and rounds of focus groups, went to an almost 400 plus page book that we created,
Yeah.
trying to explain things in kind of, simple language, lots of analogies, lots of visual illustrations,
Yeah.
and honed it down, try to figure out each week sort of what are some disease concepts or symptoms that we want to communicate, and also what are some key caregiving things. So adapting to changing roles and relationships that are changing, because these can be really different for Parkinson's caregivers compared with someone else caring for a loved one with a different serious or chronic illness.
Mhm.
So we've tried to work on all of those things and to make sure that in the curriculum we don't just have the same usual photos of the same older white gentleman with
Mhm.
Parkinson's, because that's not everyone who has this.
Yeah.
So trying
Mhm.
to recognize the diversity in who we serve.
Mhm. Well, yeah, and you got it right from the source. This is what they really want to know about, and you incorporated it into the education program. So I can see why you would be seeing these positive results. And based on the research that you've done, what are the most pressing needs of care partners that healthcare providers and support systems should address?
Oh, that's such a great question. So, really, I think our care partners need support in so many
Mhm.
ways. I think they need recognition and acknowledgement and validation that what they are doing is critical, that what they are doing is time consuming and emotion consuming,
Mhm.
and that so much of the work they do is unseen and underappreciated. So, I find I have an amazing clinical team that I work with, and hopefully every visit we are looking at our care partners regardless of where people are at in their Parkinson's and saying to the care partners, how are you?
Mhm.
And often we're the first people that have asked them, and that's shameful, right? Or
Mhm.
just saying, I see you and I see what you're doing and it's incredible.
Yeah.
um, so I think acknowledgement that they are a critical part of a person with Parkinson's thriving,
Mhm.
and our system needs to be better. Too many times people will come to me and say, okay, Jory, I'm ready. Can you send me a caregiver? And unfortunately, insurance,
Mhm.
Medicare, Medicaid really don't cover paid caregiving.
Mhm.
Even hospice services, will provide a nurse who visits once a week, maybe twice a week, maybe a little bit of help with bathing, but not full time or
Mhm.
24/7 care that many people need. So
Yeah.
we need system change to really help with aging and disability care.
Mhm.
And until then, family, neighbors, when people say, how can I help? Sometimes that's a really hard question for a caregiver who's
Yeah.
in the thick of it to answer. So if you're one of those family, neighbors, friends, offer something specific. Can I bring you dinner on Wednesday night? Can I take your loved one to physical therapy so you can just get a break or do the grocery shopping then?
Mhm.
Right? Or if it's an adult child who's in the mix, like, can you call mom, you know, every Tuesday at this time? They'll really look forward to it. You can have a conversation, and I know that I can go and get in a shower.
Mhm.
Um, and if you're a care partner, thinking about what are those things that you don't have to do, someone else could unload the dishwasher,
Mhm.
right? Someone else could go pick up the groceries or take the cat to the vet. What can you delegate, and who in your network can support you?
Mhm. Yeah, that's really powerful advice. So, yeah, first talking about that validation, how important those care partners are, and that they do need to be recognized. And then how can they possibly outsource some things? We know that when people get diagnosed, you hear lots of people in their environment say, okay, yeah, whatever I can do to help, let me know. But then maybe years down the road, hey, you can cash in on some of those. Hey, remember when you said you would help? Well, here's something that I need. So I love those examples you gave. Just be thinking about that and what they can outsource to try to get a little bit of reprieve. So yeah, really great ideas. And how do you envision the results of your study being implemented in clinical practice to improve care partner support?
So right now, I guess you need to take a step back and kind of describe like the actual structure of the study right now, because we've been so successful in pilot testing this idea of having a really specific Parkinson's and Lewy body curriculum that's been
Hmm.
tested and tested, and everyone has kind of looked through and been like, all right, we're good. Um, we're now open in this national, entirely virtual. So no one has any study visits anywhere but at their own phone or computer. But it is a randomized controlled trial where we are recruiting 120 either current or past experienced care partners whose
Hmm.
loved ones either are at least 3 years into cognitive change in their Parkinson's, or 3 years into their Lewy body dementia, or they may be care partners who've lost their loved one. And we will train folks. Some of it is pre-recorded, some of it is live with our study team, talking through some of those issues, getting everyone on that same page, and then also practicing, like, what if some difficult conversations come up? What if someone asks a question? What if I hear something and I really want to go over there and help them?
Hmm.
Even if you might be a mentor in Montana who's got, a mentee in Maine, right? How do we kind of navigate really sticky situations, and how do we maintain boundaries? And
Hmm.
then we'll be recruiting as mentees over 500 caregivers who are within the first 3 years of their loved one having cognitive changes. And they will be evenly split. They'll be randomly assigned to either sort of the full intervention, or we don't really have a true control group. In
Okay.
a scientific study, often we think about, we'll give you the real drug or we'll give you a sugar pill.
Hmm.
But knowing how much our care partners need, it
Hmm.
doesn't feel ethically okay to do nothing.
Hmm.
So we've taken the full intervention, pared it down a little bit. And so even folks who are randomized to our education group will get a 12-week curriculum that says, here are the topics we think are really important this week, and here are vetted, trustworthy resources. Go check out this page on this foundation. Go learn about this topic on this foundation this week. So we're trying to give people some of what's out there, but in a way that's digestible, that they don't have to navigate Uncle Google and
Hmm.
not know what to trust, right? And so and then the folks who get the full intervention get that whole curriculum, both sort of a handbook and a website, and they'll be matched up with one of our trained peer mentors who calls
Hmm.
them every week and kind of talks through that curriculum.
Okay.
And
So is that
so
is that the main difference, the peer mentoring?
the peer mentoring and kind of the full curriculum
Okay.
versus just the pared down curriculum.
Okay. Got it. Okay.
And so we will sort of, the curriculum lasts 12 weeks. And so we'll compare how our caregivers do from their, baseline surveys, to that 12-week mark, in terms of things like caregiver strain, their own health outcomes. How are they sleeping? How is their mood? And then we think that it will take time for what they learn to kind of percolate and impact how they're caring for their loved one. So we'll check in with them every 2 weeks for the next 6 months after that. Very short surveys, less than 5 minutes, just kind of checking in. How are you doing? What's going on? And also, not only do we want to see if this impacts our caregivers, but we also want to see if this is making a difference for our people with Parkinson's and
Hmm.
Lewy bodies. So they don't actually have to fill out any of the surveys, but we ask our caregivers at the start and then every 2 weeks throughout to let us know how often their loved one is falling. Has their loved one gone to an emergency room or a hospital in the past couple of weeks? And
Hmm.
that way we can actually look at, once the two groups, sort of the lighter intervention and the heavier intervention, do we see them diverge in terms
Hmm.
of being able to prevent some falls, prevent some emergency room visits, in addition to changes in how the care partners are sort of coping as well.
Yeah, that's really great. So how long is enrollment open?
So we opened in mid-May. And we have will probably be open for another few months for our mentors, and probably at least 9 to 12 months for our mentees. So for those newer people who are currently caregiving and in the first couple years of their loved one having symptoms, we are open for many more months, aiming to reach that number of 500. So I think one of the most incredible surprises for us, and maybe we shouldn't have been surprised, is that while we've partnered with amazing foundations who have really big reach, like LSVT, we've gotten so many people who've enrolled, and they've checked off in the "How did you hear about us?" box. They've checked off word of mouth from another caregiver, or my local support group who heard about it from someone else who heard about it from someone else. So in the incredible community of people with Parkinson's and care partners and healthcare professionals who support them just blows our minds every day. So we hope that the more people hear about this, the more outlets they hear about it in, we will be able to enroll all of those folks more quickly and get answers out to everyone.
Yeah. Well, it sounds like if they're getting that word of mouth, people who are familiar with the study can see the benefit and what it can do, and they want to spread that too. So it's great to hear that word of mouth is helping so much.
Yeah.
Can you discuss any, I guess you kind of already have, but any unexpected outcomes or observations from your research that might lead to new research directions?
Well, I think that one of the really surprising things, encouraging things that led up to this study was, we thought, well, maybe we'll improve people's knowledge, we'll improve their strain, which we saw. Part of this, though, is recognizing, right, that there isn't that safety net there for our care partners. And so how do we build something sustainable that isn't super expensive, right? And when we asked people who did the prior study looking at peer mentoring, we asked our mentees, would you do this again? And would you want to go through it again as a mentee? Do you feel like you have more to learn? Or would you consider being a mentor? And 40% of people said, I want to do it again as a mentee. I feel like I have so much more to learn. But 50% of our mentees said, I'm ready to pay this forward, and I'm ready to do this for someone else and make this journey better for someone else. And 90% of our mentors said, keep me on your list. Call me next time. Right. And so to have that, I mean, again, it just speaks to, I think, the need and the unbelievable lived wisdom and dedication of caregivers in this community, who are still, so many are still caregiving, are still on call 24/7, and are saying, yep, I will make an hour that is precious, that I could be using for anything, and I will use this to make someone else's life and journey a little bit better than mine was. That's amazing.
That is amazing. That's very powerful. Yeah, you're right. That hour could be for anything, but they want to help pay that forward. So, wow, that's pretty neat. So who can participate in the PERSEVERE study, and how do they learn more about it and how to participate?
So if you are a family caregiver, you could be a spousal caregiver, significant other, you could be living with your loved one, but you do not have to be. You could be an adult child caregiver or a family friend. So we're defining family as loosely, could be blood family, could be chosen family. But if you spend at least 10 hours a week in some form of caregiving for a loved one, you count as their caregiver. And if you were a caregiver and met those criteria, you lived with or spent at least 10 hours a week on average. No, we're not counting. That could be coordinating visits, that could be helping and sending groceries, that could be checking in. That counts. And for this study in particular, we do require that not just the diagnosis of Parkinson's, but Parkinson's with at least some cognitive change, or Parkinson's dementia, Parkinson's with hallucinations, or people may come into the study and their loved one's been diagnosed with dementia with Lewy bodies, or the umbrella term of Lewy body dementia, which is all super confusing. But essentially, if you've got Parkinsonism, slowness, stiffness, tremor, changes in walking and balance, and you've had changes to attention, concentration, judgment, problem solving, kind of fluctuating levels of alertness from moment to moment or day to day, or visual hallucinations, come on in. And we have a website that basically walks people through what exactly is this in more detail, both in print and also in video form, recognizing that people learn in lots of different ways. And you answer a couple of simple questions that help determine whether you are eligible to participate. People do have to live in the United States or a U.S. territory. So Guam, Puerto Rico, we are looking for you. We have resources at the ready. And people do have to have a working telephone number and reliable internet access, because a lot of the interventions are answering surveys online or on the phone. And so people can go to our website, and I just realized, I'll pause, I'll pull it up and I can give it to you.
Okay. And I can include this in the podcast description too. So the link will be there. Yeah.
Awesome. So the website is https:// all one word is redcap.link, LINK, /persevere1. That's PERSEVERE, the number 1. And that site has all of the information, has videos. We actually even have videos with testimonials from Parkinson's and Lewy body care partners who have gone through and been part of earlier versions of this, talking through their experience being part of that.
Okay.
And
well, great.
Yeah, once everyone fills out the study, so it's not entirely all online. We do have our study team. So one of my 2 phenomenal research assistants calls each person who qualifies, and you'll get sort of a heads up from your survey answers of whether you're eligible for the next step. But you'll talk with one of our research assistants who'll make sure, do you have any questions? Do you have any concerns? What was unclear? And answer any questions live, a real human. And then we also have our team always behind the scenes, my 2 research assistants and a study social worker who's been a movement disorder social worker for over a decade.
Wow.
So that as time goes on, as people are mentoring, as they're going through the curriculum, if things are coming up, if there are questions, if there's additional need for support, we've got you. So there's a team kind of behind the scenes. We can't offer specific medical information because we're not the treating physician or treating team, but we can point people to resources in their communities and organizations that could help.
Oh, perfect. That sounds like a great support system for that study. Before we wrap up, I wanted to see, is there anything else that you want to share about the study with anyone in the audience today?
Yeah, I think, one of the things that we know is a challenge in so much research, and particularly is a really big challenge in research on folks with Parkinson's disease and related disorders, is many of our studies, the people who participate tend to be highly educated individuals who are white or identify as Caucasian. And we know that that is not everyone who has or is affected by Parkinson's disease. So in particular, we are really hoping to enroll individuals of color. We are really hoping to enroll male caregivers who are quite underrepresented. And we're really looking for rural dwelling caregivers, because we know that individuals in each of those groups may face different and really specific challenges. And we want to make sure that we have mentors in those groups and mentees in those groups. And something I forgot to mention earlier is, how do we match people up? And this is something that, other peer mentoring programs in Alzheimer's, in cancer, and various other conditions have kind of looked at this idea of, does it matter if you just match people and assign them randomly or not? And the data's kind of we really thought it probably makes a difference. And so in our last study, we actually asked people, hey, of all these different factors, for example, gender identity, relationship to the person with Parkinson's, geographic area, things like that, how important are each of those things? And if you had to tell us your top 1, what's the most important thing that you would like to have in common with your mentor? And then we matched people accordingly. And we found that that seemed to really work.
Yeah.
And so we do ask people, what is important to you? We know sort of which time zones people are in and try to match people up in ways that are concordant with their wishes.
Mm-hmm.
And we also ask people, if you speak another language. So all of the surveys are in English. So people have to be comfortable and fluent in English. But if you are bilingual or multilingual, we do ask people for that because we may have mentors and mentees who may be more comfortable speaking in Mandarin or speaking in Spanish. And we want to not just honor that, but celebrate that.
Mm-hmm.
So we try to ask that as well.
That's great. Well, you've covered a lot. I want to make sure you have the final word if there's anything else on the
Oh,
study.
just thank you so much, Beth, and thank you, LSVT. And um, I am someone who was trained with LSVT, going through my fellowship, and just recognize the impact of being big and being loud. And I think this is a way for our caregivers to be big and loud in their own way and sort of amplify their voice and their impact amongst each other. So thank you so much for the opportunity to share this with your community.
Yeah, well, thank you. We really appreciate your support. And I can tell your patients and their family members are very lucky to have you under their care. And I look forward to hearing more about the study and the results. And I can tell it's going to make a big difference. So thank you for your passion and sharing that with us here today.
Thank you. It's my pleasure.
All right. Well, I'm just going to have some final credits here. And I want to, of course, thank our special guest, Dr. Jory Fleisher from Rush University Medical Center. The theme song that you're hearing as part of the podcast is called Think Loud for Parkinson's by Kindred Spirit and Leo Sayer. The song and video were inspired by LSVT Loud speech treatment and were developed to raise awareness for Parkinson's worldwide. The song's available for purchase on iTunes and Amazon, with the proceeds being split between UK charity Cure Parkinson's and the Parkinson's Foundation in the US. Our production team, who helps put together all the logistics of the podcast, is CS Design Studios. And as Dr. Fleischer mentioned, if you want to learn more about the PERSEVERE study, you can visit their website. It's redcap.link/persevere and the number one. And I'll put that in the podcast description so you can easily access that. And you can watch a video providing more information about the study and then also hear prior or testimonial from prior PERSEVERE study participants. If you're interested in learning more about LSVT Loud speech therapy or LSVT Big physical or occupational therapy, or you want to locate therapists in your area, you can visit our website at lsvtglobal.com. And we'd encourage you to click the subscribe button wherever you get your podcast so that you never miss an episode. And we look forward to thinking big and loud with you again next time. So thanks for being with us.
Yeah, yeah.